Current changes of your service delivery environment. The environment is changing, but the regulation remains static. The mechanism that takes care of all levels of care up to the authority level.
The counties are the employers of doctors. So us as a ministry, we come in between as a mediator to mediate between the counties and the doctors, because they're the ones who are employing them. Even the CBAs that you see, most of them have been signed by their respective counties. That notwithstanding, it is not all gloom and dull. Now we want to operationalize the Kenya Health Human Resource Advisory Council, so that then it takes up the role of mediation, it takes up the role of being able to take care of doctors across without clawing back on the benefits of devolution. In the country, we have some people practicing as medical professionals, yet they are not. And that's the main reason why we are here, that this institution, we have an institution that is supposed to be licensing practitioners, So it is that institution to step up in terms of being able to walk through the country and ensure that everybody who is practicing is licensed. And if they find somebody who is practicing and not licensed, then they should be able to close down and crack down on that person. Yes, and not just in Garissa, but across the country. And as you are aware, the Kenya Kwanza Manifesto gives a focus that we are moving from curative to preventive and promotive health services. Preventive and promotive is where we focus on things like hygiene and sanitation. Most of these diarrhea cases is because we are not taking care of the base of the health sector. We are taking care of the top. So when we focus now and focus on prevention and promotive, ensure that the health standards, the sanitation is done. Even in the schools that we're experiencing issues, if only proper sanitation, proper hygiene, and food handling and storage, that should be able to take care of diarrhea cases within the country, not just in Garissa. The country is under a very tight fiscal space. National Treasury is having to balance in terms of priorities. And with the mechanisms that have been put in place by His Excellency the President in terms of managing the economy, my expectation is that things will improve, and as a Ministry of Health, then we'll get what our allocation is. KEMSA has supplied commodities to counties. Counties have not paid, and counties will come back and say they have not received their money. So there's quite a lot of work that needs to be done between the national and the county governments for us to be able just to know how we manage this health space.
I know we'll jump KMTC because we have one of our friends who has an issue.